coming up, we'll be on location at Agent of Change LLC in Waldorf, Maryland, discussing the benefits of mental health and behavioral therapy and how it can effectively help improve your life, relationships, career, and overall well-being with one of this region's top mental health experts, Bertha White. Welcome, Bertha. It's a pleasure having you on our program today.
It's a pleasure to be here. Thank you.
You're welcome. It's your first time, in fact, on with us.
Yes.
We have a lot to talk about, and we've had, obviously, the COVID pandemic, unfortunately and tragically in so many cases, affecting the whole world, let alone all of our communities here in the DMV region.
Absolutely.
And it has affected folks in so many ways. And obviously it's resulted in a not so surprising huge increase, significant rise in mental health issues, heightened a lot of the issues that folks already had.
That's
right?
true, yes.
Even prior to the pandemic. And I wanted to begin, if I may, Bertha, by having you please tell us what some of the most prevalent mental health and behavioral conditions are in this environment that you're seeing right here on the front lines, helping so many folks in the community as you do.
That is a great question. What I'm seeing most is a spike in anxiety, depression, trauma, race-based stress injury, and adjustment disorders.
And what do you believe to be the cause of many of these conditions? Obviously, the pandemic, as I just mentioned a few moments ago, has certainly heightened and increased a lot of issues that folks already have. But from a holistic approach, as far as the root cause of many of these issues that were there already previous and prior to the pandemic, what do you see or attribute that to?
Well, the issues vary. You know, the pandemic brings so many adjustments. It's created so many losses. Depending on the age group, we're talking about losses in tradition. For our kindergartners, say for instance, there used to be the graduation going from kindergarten to the first grade, or our seniors who may not have been able to experience the tradition of a prom and walking across the stage. You know, those are significant issues that our youth are dealing with. In particular, there is the social piece. You know, we've been isolated for so long. For our parents that have been thrusted into being teachers and adjusting to that, teaching and working from home at the same time. And now what we're experiencing is yet another adjustment to going back to work and being back in the classroom and having to, you know, engage with our peers, those of which we may not have seen in so long. So the issues are, you know, they go on and on and on. There are a lot of reasons why, you know, our youth, our teens, parents, couples, families are experiencing these increases in distress.
Yes, indeed. And a great point you also made a moment ago, Bertha, that I just wanted to follow up on, and that is that when the pandemic occurred, obviously it's winding down, but there's still a lot of issues that are afflicting so many folks. But people really were, like you said, the schools, all of a sudden after our entire young lives as students, we suddenly are now doing Zoom and Skype and virtual classroom sessions, right? Instead of interacting and being there with our friends and fellow students.
Which really creates a great deal of anxiety. You picture being in a classroom for a student. Normally I'm sitting here, my classmates are here, or they're behind me, and the teacher is in front of me, and we're all looking this way. Well, with virtual teaching, especially at the beginning, everyone's looking at you.
That's right.
And that creates a great deal of anxiety. What I found is that there are students that, you know, will turn the camera up towards the ceiling or not have the camera on at all, or what's worse, not attend.
Which is even worse. You're absolutely right. Another great point. And now, and same with the adults in the working world. From suddenly going and doing that drive every morning, and then again every late afternoon or early evening to work and back from work, but still being there on a social basis, interacting with our fellow workers and colleagues, to suddenly also having to work from home.
That's right.
So then to go from all that, which really occurred over a couple of year period, basically, for so many folks, to then suddenly go back to work.
It is an adjustment.
To go back to college in
Yes.
person with everyone, not just virtually or online, right? That is a big adjustment.
It is a huge adjustment, and what I'm seeing is more of a lack of self-confidence and esteem and worth that people are struggling with as they get back into the social environment.
Yes.
And, connecting with their peers again, all of that uncertainty when you haven't been around them for so long.
Yes.
And that is absolutely critical, having that peer interaction, no matter what age you are, that social piece. So it's just been, trying for most people.
Yes.
It's really been trying to varying degrees. And so I encourage everyone, if you're struggling with any of this, to seek help immediately. That is the most important piece, to seek help immediately. We expect for there to be some discomfort in the adjustments that we've all had to experience, but if that extends, and it starts to affect the way that you're thinking, and it starts to affect your emotional balance, and it starts to affect the way that you react in your behavioral responses, that's the time to seek help.
Absolutely. Very well said. And it's really a readjustment in many ways.
Absolutely.
If I may use that term.
And it is.
Yes.
Some are adjusting better than others. Thank goodness for that.
Yes.
And others need more support in making those adjustments.
Yes, absolutely. And it's not just to related or limited, I should say, or focused exclusively on folks going back to work in person or students going back to school in person, but also in relationships.
Absolutely.
And going back out to restaurants, not having to wear a mask in many places now.
Yes.
These are all adjustments as well.
They are. We've just gotten used to, if you will, some of us, in wearing the mask indoors,
Yes.
and where have you. And now that things are a little more relaxed and there aren't as many restrictions, you still find people concerned
Yes.
in wearing their mask. And I say, if that's what makes you feel most comfortable, wear your mask.
Yes. Whatever makes that individual comfortable.
Absolutely. Yes.
Totally agree with that. And what adverse effects can all this have on our lives and our families? And I know you touched on that to some extent, but if you could please elaborate on that, Bertha.
Well, what you might find, first of all, let me say, if there's a change in the way that you're thinking and you're experiencing any suicidal ideation, plan, or intent, call 911 immediately or get to your nearest emergency room. But you'll see that, definitely changes in, the positive presentation. There may be more negative thinking. There may be more hard emotions experienced. There may be some crying, some feeling of loneliness, that people are struggling with, as well as the behavioral changes. I have to say, for our kids and teens, oftentimes they are not able to express themselves that clearly, and you may see a change in their behavior opposed to them being able to express something's not feeling right. Yeah. I would encourage parents, teachers, our educators, as well as health providers, to pay attention, to listen to what your patients and your students and children and family members are saying. When we come together as couples, we might learn some things about each other that we had forgotten or that bother us or so forth. Communication is the key. Yeah. It is okay to talk about these things and gain understanding. And as we communicate with each other, what is absolutely critical is validating. I hear what you're saying. I'm understanding you feel this way. That is going to make it so much easier for, whether we're talking about couples, whether we're talking about parents and children, whether we're talking about students and teachers, to just understand what each other is experiencing and to help understand better the type of help that's needed.
Yes, indeed. And what is the evaluation process? Because this is something we get a lot from the community, asking us, what is the evaluation process, for example, within a mental health therapy practice such as yours? when diagnosing a patient's condition or a specific issue or issues they may be dealing with? What do they typically go through from when they initially contact you, Bertha?
Okay, well, when they initially contact us, they're going to experience a phone consultation, just some identifying information and a little bit about the presenting problem. They're scheduled to come in normally within the week. When they come into, our agency, they're welcomed, made to feel comfortable. When they come in, they're going to see me. And, the very first thing that we have to do is go over all of our consent forms. It is very important that you're aware and informed of what to expect in therapy. The next thing they should know is that therapy is supposed to be tailored for the individual. We're all experiencing different circumstances. We're not clones. We come with our individual concerns. I would take your information in terms of background information, family information, work history, psychological history, health history, work information, social information, relationship information, just so that I get a clear picture, an overall picture of who you are and what your struggles may be. Furthermore, when we go into detail like that, it's a little easier to see where the underlying issues may have started, how they may have intensified. We get to learn what you've done that may help yourself along the way. We identify strengths, we identify weaknesses, and we move forward together. What's important is to help you to, first let me say, it's not always easy to come in and talk to someone that you don't know about your circumstances. Taking that first step towards your journey of wellness is difficult. And so I welcome people to come in. And we take things at your pace. I'm not going to rush you through your story. I understand that everyone is experiencing something different. And so once we gather all of that information, we determine why you're here and what is it that you want to get out of therapy. Those are the goals that you set to accomplish, and I'm here to support you in doing that.
Yes, indeed. It's a very comprehensive initial evaluation to
Absolutely.
get a really good snapshot or a profile of each of your patients and
That's
clients. Right. And then you basically, through the needs analysis, then customize the appropriate therapy and or therapies and the right options that can best help each of your specific patients and clients. Because as you so well said as well, Bertha, we both may have depression, for example, but you can't necessarily customize the same plan for both of us.
Absolutely.
Because no two people are ultimately alike.
That's
even
right.
though we may have the same condition.
That is correct.
And that's where you come in with all your expertise, your holistic approach to finding and looking to solve the root cause of your patient's problems.
That's right.
Not just a Band-Aid approach.
No, that's not going to be helpful in the long term. So we do a either child, adolescent, or adult psychiatric diagnostic evaluation. Okay. That helps to give the information to determine whether or not the person before me meets diagnostic criteria for a mental health disorder. Oftentimes people come in and that's not what they're experiencing at all. It could be trouble adjusting to all of the stressors that they have going on in life. And we work our way through that as well. So depending on what the person is experiencing, the intensity, the duration of those symptoms is where we start and determine how we're going to proceed. Because what's absolutely necessary is for you to be able to identify what it is that brings you in. We have to identify it before we can move towards challenging that problem and coping with that problem and hopefully overcoming that problem. We need to know what the problem is. And that could be one of the most difficult pieces, expressing what it is that you're experiencing.
Yes. And is there a type of person, Bertha, would you say is more susceptible to developing some or one or even all of some of these more common mental health conditions that you've talked about?
Well, what we see most in children is conduct disorders, adjustment disorders that come with disturbances of mood. It may come with disturbances of anxiety or a mixture of both, disturbances of conduct. We see a lot of anxiety and depression in women in particular. We see a lot of challenges with our couples. So, it just depends on the age group, but behavioral issues, without question, anxiety, depression, and the ages range. What would normally, prior to our pandemic, pre-pandemic, the common disorders would be the anxiety, the depression, the trauma in specific age groups. What we're seeing now is a mixture of everything. So I would not say that one thing is more common than another thing, because these circumstances and the times that we're living among has created things that we've not seen before. So the challenges vary. I'm seeing anxiety more in children, than I've seen before. There's a huge spike in anxiety with children, and social anxiety in particular. And adjustment disorders in particular that come with that anxiety piece. It depends on the individual. I don't want to make a blanket statement and say this is more common and this is more common and this is more common, because I don't want to minimize anyone's circumstances that they're experiencing. What you're experiencing is important.
And what would you say for the folks watching, having heard all this thus far? Would you say are some of the most effective strategies or therapies or tools, if I may use that word, in your toolbox that you can effectively help and treat your patients and clients with?
Again, just the ability to identify what it is that you're experiencing is an important tool to be able to say, this is what's happening with me. Strategies that will help one to recognize triggers to changes in their cognition and the way that they're thinking. Maybe some cognitive behavioral therapy that may focus on that. When you feel triggers to changes in the way that you're acting towards others, be aware of that, and strategies to help to balance reactions. And control your reactions, I should say, to stressors. Sometimes it's not even a stressor that causes us to react. And emotional balances, strategies to help you to gauge your temperature, be able to use appropriate words to express what it is that you feel, and balance and modulate your emotions. So it depends on the individual. There are a number of strategies, modalities, and interventions that can be used, including referrals to a psychiatrist to determine whether or not medication would be a good intervention to add to therapy. So it depends on the individual, and without question, familial involvement. Especially when I'm dealing with children and youth, it's important to involve the parents so that they have a better understanding of, first of all, how to control themselves through parent management skills, and then how best to help their youth.
And I love the fact you utilize an integrative approach here at your practice, and you utilize, as you just said, the various therapies and options that you have at your disposal with all your many years of expertise in mental health to really help and customize the appropriate solutions to help your patients and clients achieve their goals and work through their challenges, right, as we go through life.
And being a certified clinical trauma professional, as well as a certified dialectical behavioral therapist, really helps me to hone in on what the individual is experiencing and what strategy is going to work best for them. So we just don't do cookie cutter here.
No.
Everything is tailored for the individual.
Just like everyone is different, as we said, right? So you utilize what's needed to help that particular person.
Across settings too. When we are experiencing these types of conditions and distressing factors, it can present itself across settings, at home, school, work, community. And so strategies that best fit those areas as well is going to be beneficial. What you may be able to do at home, you may not be able to do on the job. And so, just picking and choosing what's going to work best for you. And what is an important piece is that individuals have to understand that in order for us to know if this is effective, you actually have to do this. Commit.
That's right.
And live your life with intention. And be able to come back and tell me whether or not this is helping, if this is effective, because if it isn't, we need to tweak it just a little bit so that you get the most out of your time here in therapy.
You really maximize their time that way.
Absolutely.
And really it goes back to what you said earlier as well, Bertha. Communication is key.
It is.
And it is a partnership between you and your patient or client to really work together.
Yes.
And they have to also be willing to take the steps necessary. It's a two-way street.
Absolutely.
You can't help yourself otherwise.
Yes, that's right. I can't make the change for you.
Yes.
When you leave my office, you're on your own. I'm available for urgent matters, of course, but it is up to you to practice what you learn here,
Yes.
So that you can live a balanced life. That's the objective, to balance things out.
Yes.
So, yes, practice is absolutely necessary. Use the skills that you've learned.
Absolutely, Bertha. And what kind of results can be expected? And I want to put in the proper disclaimer that I'm sure that depends on each patient or client, and along the lines of what you just mentioned a few moments ago, and how much they're also putting into it and learning from their sessions with you. But typically or generally speaking, what kind of results are you seeing?
Well, provided one is engaged in their therapy and, they're practicing the skills that they learn here, the hope is that an individual can control these symptoms enough, number one, identify the warning signs,
Yes.
and then be able to kick into action your strategy, your technique, your coping skill to control whatever the symptom is or behavioral response is that you're experiencing.
Yes.
That is the goal, to control it. We're hopeful that once you're able to do this, the symptoms that you may have been experiencing are few and far between. When they do occur, you're able to control them and manage them so that they're not so disruptive in your life.
Yes, so there's progress from the results are there.
They're there.
As you work together with each of your patients and clients.
Absolutely. And because there's so much going on in the world today, I don't want to say that someone is going to be cured.
Yes. Yes.
We are all under construction, and we have to work at it every day. Be intentional about what you're doing every day.
Right.
And so in saying that, yes, you can help yourself, and you can definitely decrease the intensity of what it is that you're experiencing so that you live a well-balanced life.
Absolutely. Improve our overall wellness, mental health.
That's the goal.
And really mind, body, and spirit all working in conjunction.
Yes.
And again, the next question, I know again this depends on each person, but typically speaking, how many sessions are usually necessary to start seeing some results? And again, I know that depends on each person, their condition or conditions, and things along those lines. But I guess just like with the previous question, typically or generally speaking.
Well, if the circumstances that bring you in for treatment are mild, then it won't take as long, provided we have an understanding of what it is that you're experiencing, we find the correct tools for you, and you utilize those tools. You may be looking at maybe a month or two or three of treatment, depending on the severity.
Sure.
Now, if you come in with symptoms that are moderate to severe, it of course could take longer to deal with. And as well, if you're coming in because of a traumatic situation, that could take even longer to deal with. So as you said, and we know, it depends on the issue that you're coming in for, but if that issue that you're dealing with is at a moderate or mild level, then you should not be looking at therapy long term. But for something much more severe, you can expect for it to take a little longer for you to process thoroughly what you're experiencing and be able to use the tools that you've gained in therapy to lessen the intensity of what you're experiencing.
That makes perfect sense, Bertha. Absolutely. And the results as far as them becoming permanent, again, I know that depends on each patient, but generally speaking, if they make their commitment on their end like you do as their therapist, and you work together through the sessions that are needed to help them achieve their goals, can these results end up being permanent as well to help them?
The corrections and
Yes.
the ability to control?
Yes.
Yes.
That's a
now,
big
I will
step.
say, on occasion, I have someone come in for maintenance.
Yes.
You know, and
Yes.
that is fine to do. Recognize when you need that. Don't, be afraid to reach out for help. We're fighting against stigmas and microaggressions all the time.
Yeah.
Make yourself a priority. That's not a selfish thing to do. Make yourself a priority. Come in for help when you need the help. Get what you need and be happy.
Yes, absolutely. Very well said indeed. And yes, because once we feel better and we've achieved our goals by coming and seeing a therapist such as yourself, you're absolutely right. It's so important to occasionally come back in for the maintenance
If you need.
visit, whether it's in person or online. You offer both.
Yes, I offer
and,
both.
And because you're right, there could be regression. Sometimes these things happen.
Exactly.
Another event can take place that could hit a trigger that makes us go back into a mental state that you helped us overcome.
Exactly.
So that's why the maintenance visit, and you're always there for your patients and clients throughout as they need you.
I most certainly am.
And what other types of therapies, I wanted to ask you, Bertha, do you offer here at your practice, Agent of Change LLC, in addition to the ones you've talked about today?
Well, as I said earlier, I am a certified clinical trauma professional therapist, and also a certified dialectical behavioral therapist. Those things in particular help me to support clients that have experienced trauma and those who are experiencing personality type disorders, in particular borderline personality disorder.
I see.
So I experience clients that are struggling in those areas in particular. So I use modalities and approaches with those types of therapy. In addition to, the traditional cognitive behavioral therapies, just to, help balance things out. Sometimes one particular therapeutic approach doesn't offer everything that you need. And so you may need to pull an approach from another modality or another therapeutic approach.
That's right.
To offer that client, just to bring some balance. Again, you don't come in, as a clone. So we use what we need to use. We pull from here and here and here to tailor the therapy for you.
Yes. Now we're literally out of time, but I wanted to ask you, Bertha, before we let you go, you and your practice, Agent of Change LLC here, located in Waldorf, Maryland, Southern Maryland region, have certainly established a reputation for excellence in effectively treating mental health and behavioral conditions that that are affecting so many patients and folks throughout the area. Excuse me, let me redo that last part. That are affecting so many people throughout the region, as you've touched on and went into in some detail in this interview today. But you also have a very stellar reputation in patient and client care, as well as bringing all your expertise of 20 plus years of experience and all the modalities within mental health and your integrative, holistic, and wellness approach that you've touched on, that you also bring to the table to help each of your patients and clients truly feel better and achieve the goals that they need to achieve as they go through their journeys in life. I just wanted to ask you what you feel really helps separate you and your practice apart from many of the others.
Well, we want people to feel welcome from the moment that you walk through the door. We want you to feel welcome. We want to, to induce calm with aromatherapy. Our offices are well designed. Our staff is extremely professional. We pride ourselves on being culturally competent and culturally connected. What you're going to find is not just talk therapy, not just psychotherapy, but we will, engage you in groups as well. We have signature groups that we offer here. We have our Harambe Youth of Southern Maryland, which is geared specifically towards African American youth, ages 8 to 18. It's combined. It has two facets. One, mental health piece to help our youth to, number one, understand and improve their mental health knowledge, their perceptions of each other and themselves. And then just to create a healthy environment where they can express themselves, real life situations. Yeah. That's the first component. And then the second facet of this group is Black history, culture, education, yes. Leadership skills, social involvement, community involvement is what we engage the youth in. And then we have other groups as well. We have couples groups, we have hand dancing classes, we have groups for women called Overcoming, where we focus on women that are struggling with anxiety, depression, and trauma. So it's not just, coming in and speaking with someone about your troubles. There is a connection here, in addition to connecting you with others that have experienced situations similar to what you have. So there's a support group here as well. Not just the in-person treatment, there is also the virtual treatment. We're giving options as well, because not everybody is comfortable coming out just yet. Yes. So we offer that as well. We pride ourselves in quality mental health care. Agent of Change is designed to be a place that I would want to come to.
Yes, that is so well said, and so much from your heart and practiced by everyone here at your practice. Yes. Towards helping so many folks in the community, helping them change, mm-hmm. helping them evolve, helping folks through their journeys.
Helping them to help themselves.
Yes, which mm-hmm. is so vital, so mm-hmm. vital. Mm-hmm. And you are certainly very community oriented and focused, as you've mentioned as well.
Yes.
It's not just helping individuals, you help groups and couples and families.
Exactly.
And so many. And that word you use, connectivity, so much applies to you and your practice with the community. Mm-hmm. A lot of folks say it, very few actually do it. You certainly are.
I appreciate that.
And on that note, we'd like to thank you, Ms. Bertha White, for joining us, being on our program, and mm-hmm. being our expert today.
Thank you. Thank you.
And you certainly bring so much depth of experience and knowledge and expertise, as I've mentioned, that it was truly an honor for us to have you on today.
I appreciate you being here.